At this ESMO 2019, what we have seen is an update of the JAVELIN Renal 101 study. So this study is a first-line metastatic kidney cancer study, which compares standard of care Sunitinib with a combination of Axitinib plus Avelumab. Therefore, it's a dual approach of an immune checkpoint inhibitor plus a VEGF targeting agent. And so it's actually several subgroup analyses that have been reported, and the one I would like to focus on is the one which tried to assess the response on the primary for those patients who didn't have surgery on their primary tumor before starting systemic therapy. Why did we try to analyze that? Well, because in the context of Carmina and the fact that more and more there is an understanding that for those patients who require systemic treatment, we should start with systemic treatment and maybe discuss cytoreductive nephrectomy in patients that are deriving great benefit or long-term benefit. We wanted to assess what is the response on the primary for those who didn't have surgery. So within the 880 patients that were part of the trial, about 60 in each arm didn't have prior surgery. So for those patients, we looked at the response rate on the tumor that was in the kidney so that we can assess if our systemic treatment is able to control the primary. And interestingly, we were able to report a response rate on the primary tumor of 35% for those who are receiving the combination of Axitinib plus Avelumab versus only 10% in patients receiving Sunitinib. So the 10% are what we expect with single agent TKI and what we know from the literature, but the 35% is the first time we report on the response rate on the primary. And therefore, it's important to know what we can expect for our treatment. It's the first time we're having this information in our new strategy in first line with dual approach. Similarly, time to progression on this target lesion in the primary was also longer in patients treated with the combination compared to the Sunitinib single agent. So this study is, of course, food for thoughts for us to know that we can rely on our systemic treatment in patients that received combination therapy of VEGF targeting agent plus PD-1 or PD-L1 in first line.